Okay, so REACH stands for Routine Inquiry about Adversity in Childhood. It's a programme of work that we started about 3 years ago. We started with people working with people's psychosis. So it's about kind of working with an organisational team, delivering some training, teaching people how to ask and respond, and then making sure the individual gets help.
So the support that we provide at the Women's Centre, there's quite a broad range really. We have employment support, housing and debt advice, we've got work clubs, we've also got the counselling services and all the therapeutic services as well as the groups. And we've got good multi-agency working practices as well, so we can signpost to external services.
I think it helps, the REACH helps, like the REACH questions help the most when they're not open in the assessment, and because a lot of the women, it's the first time you've met them on the assessment, some of them don't want to be very open. When you're using the questions as a net to catch everything, it's a good way to be like, oh, you've experienced this, do you want to access this other service and things like that, I think.
Yeah, and for some women as well, maybe they've accessed counselling in the past but it's not been the right time for them. Or maybe they've had a bad experience with the service, so they don't open up as much with you. But when you do get to the REACH questions, you can then start discussing that and then look at ways forward for that person.
So the idea being you can prevent poor mental health outcomes, poor physical health outcomes and poor social health outcomes by reducing the impact of adversity. So what we need to do is focus on prevention, and asking the right questions is, I think, the start of that.
The more that you work with the women, there is a pattern that kind of emerges, isn't there?
Yeah.
So I would say the majority have like high scores, like more chaotic have the higher scores. It's not really.
Yeah, and I mean it was sort of made sense as well, the training, where it looked more at the underlying issues rather than just, the one issue that the woman's facing. It's looking more at why they're facing these issues, what's gone on for them to get to this point. I would recommend it, yeah. It has become embedded as part of our assessment, so it's just there. It's something that we ask now, but it is a good tool for identifying issues that may not have been identified throughout the assessment.